Skill number one, 60-second reset. So if you are in the position, it's 60 seconds. We can practice it right now. I want you to sit in a comfortable position and go ahead and take a slow breath in. And so you can see these pictures here. You can either have like a hand on the chest and a hand on the belly. And as you're breathing in, you want that hand on the belly to go out and expand more. So that's the deep belly breathing or the diaphragmatic breathing. Or you can just have your hands on your lap and, ideally like touching your fingertips. But in any case, I would like you to take a slow breath in. And then breathe out slowly, allowing your exhale to be longer than your inhale. And we'll do this for 4 breaths. It says 3 to 5 breaths, but we'll do it for 4 breaths in this moment. Continue to do that slow breathing. You can also choose to close your eyes briefly, especially if you have some light sensitivity right now. You can hold something warm or soft for comfort, or feel something cool for your grounding. Breathe. And gently notice 3 things that you can see or feel around you in your environment right now. So for example, I can see I got a couple little squishies here, my fidgets, a cup of tea, lip gloss. I can feel that I have some tension, pain, likely inflammation in my neck and shoulders. So I'm going to roll that back and just give some loving kindness to those areas of my body. What are 3 things that you notice right now? And when you're ready, ask yourself, what is one small next step? Why does this help? When pain, fatigue, and stress build up together, the nervous system can become overloaded. When that happens, it becomes harder to think clearly, to make decisions, to even get started on tasks, and especially to regulate your emotions. And so I'll share with you this little brain model again of like we talked about, like this front part of the brain is like executive functions. Here deeper in the middle part of our brain, that's our limbic system or our emotion mind. And when we're under stress, this is the part of our brain that is most active, where there's most neurons firing and activity happening if you were to look at a functional MRI scan. And what past research has shown is that when a person is under stress, including the physical stress that you can feel in your body when you're under a flare, when that lupus activity is up, there is less access, the brain, like less blood flow, cerebral blood flow to this part of the brain that helps us with thinking clearly and making decisions and regulating our emotions. And so our emotion mind has just taken over. And when we do something as simple as a deep breath with that long exhale, when we give ourselves space to get out of our mind all the things that are on to-do list, our worries, the what's next and the what if, when we give ourselves space and we focus on our present environment, what are things that I see, things that I feel, something that I can smell, something that I can taste, that mindfulness, it allows us to quiet down the limbic system, quiet down that emotion center of our brain, and give us access again to be able to use that executive functioning or frontal lobe part of our brain. Research in lupus patients also shows that slow breathing can help restore the nervous system balance. A brief pause helps your brain come back online.